we have a special guest today, Shannon. We're gonna get all into gut health and IBS and all the nitty gritty. And today we really wanted to focus on a specific topic, and the way to do that best is to bring an expert. And so I am going to kind of serve as the moderator, and I'm going to queue up a lot of the questions that were submitted. But I kind of think it's good to reintroduce you because we've taken a couple of months off. And then if you can tell us a little bit about yourself, and then that way we can get some intros in and then a little basic information, and then we'll tee off with lots of questions.
Yes. We are so excited to start again in the fall. We've got some great ideas for October, November, December, so stay tuned. And we decided this time we have a lot of gut health questions that we get all day, every day. I deal with in my practice for my patients that are listening. So we wanted to invite Dr. Shannon Scholl to our YouTube. So Shannon, I'm going to let you go ahead and speak about your past as a gastroenterologist and board certified hepatologist, and your journey in medicine and where you were then and where you are now, and we'll talk a little bit more about the gut and all the gut things.
Okay. I am a Western trained, UNC trained gastroenterologist. I've been in the area. I was with a big group for about 14 years. I left there about 2 years ago when my daughter got really, really sick. And I was completely burned out. I was seeing patients every 15 minutes, 20 to 30 a day. And I just didn't feel like I was doing a very good job. So I left there, and I kind of reevaluated what I wanted my life to look like. And I took that time to help my daughter get better. She's doing much better now.
Yay!
And to study functional GI medicine. And so I have both an MD, a medical degree, as well as a master's in public health. And so I'm very, very, I'm a data nerd. And so I practice, I like to say, data-supported functional GI medicine. There are some things out there that I don't agree with, some things that are based only on test tube data, or that are have as their foundation mouse data. And sometimes mouse data is okay, but you need to be a little bit careful and discerning before you put those principles into practice. I opened my solo practice about 1.5 years ago. It's called Gastro Direct. We are cash pay in the office, so you pay me cash to be seen in a consultation, but then I accept insurance for all the other things, scopes and imaging and labs and all of that. You can use your insurance. So the reason that I did that is several reasons. One is that I have more time with people. So you know, I usually do a consultation for an hour, and we sit down and we talk about all of your health history as it pertains to not just GI, but also your stress levels, travel, exposures, what your diet is. I do a careful diet survey, which you don't typically get in a gastroenterologist's office because, FYI, we're not trained in nutrition at all. I got a binder, a self-study binder, and I was told to go self-study for 3 months, no exam for nutrition when I was a GI fellow. So, and that's at a really good school, really good school. I've never understood how I'm supposed to talk about or understand what's happening in the middle of you or what's coming out the end of you if I don't have an understanding of what you're putting inside of you and what that might be doing inside of you. So that's sort of self-study stuff that I'm really passionate about. So that's one reason I get to talk to people for a much longer time and get a more comprehensive health history. The other reason is that I don't have to ask insurance companies for permission. You know, we do still have to do prior authorizations and things like that, but it's kind of based on you and I and what, is that right? You and I, you and me? Based on you and me. You know, and what after our discussion we think needs to be tested and treated. And one of the things that I really love about this practice is that because it's small, I kind of can get my hands around it much better. And so I know what's happening in my practice, and I have one nurse, and we're very, very serious about customer service. So these days, you know, you call and you have to wait 2 months to be seen, and then you're just talking to some worker bee, you know, not someone who's really invested in your health. It's a factory. Yeah, it feels like a factory. And so we like to treat people like friends and family. So when you become a part of the practice, we really like to treat you like your friends and family. And if that means giving you a free prep because the rep dropped one off and we have one, then we're happy to do that. You know, just I also like interacting with patients. You know, when you've been in it for a long time, the medicine, it does get updated, and I really like staying updated. It's really I'm just still so passionate and interested in it. But a lot of it I've been doing for a very long time. But what's interesting is the people. So, and the particulars of their story. And so I really like, I answer the phone when people call. Either I or my nurse, and most of the time it's me. And if you call my practice, even if you don't leave a message, we call you back.
It's sad that that's like so special.
I know, right? It should be the basics.
Right.
It kind of feels like, I don't know, like small town medicine.
But I would, just to add to what Shannon is talking about, any of my patients that are watching, I referred a lot to Dr. Scholl when she was part of a bigger group for her endoscopies and colonoscopies. And I'm excited about this journey because how many of you out there come in every day to primary care, or you're coming to me from another practice, and you have IBS, IBD, gut health issues, chronic GERD, you can't suppress, and you're on chronic PPIs, H2 blockers, and you've been to specialists. That's what PCPs do. We refer to, the specialists. You've been scoped up and down, and GI will say everything's normal, right? Mm-hmm. But you're not any better because nobody has fixed that. And so that's still the traditional Western medicine model. And so what Shannon and I do is very different when we talk about the integrative functional medicine pathway, about getting to the root cause of disease and how foods, we talk about foods, Shannon and I talk about foods all the time, and the medicinal properties of food and the poor processing in America. So what's exciting about Shannon is she's one of the few I know in the specialty of the gastroenterology world who is branching off and saying, I'm done with the traditional model because I know there's another way to help people, and is doing her own thing, and hopefully this will take off, that more specialties start doing this as well. Yeah. So it's very isolated. I'm excited for her. I've been with her through this journey over the past, has it been 1 or 2 years now?
It's coming on 2. It's been 1
2 years. Yeah, so it's very, very exciting. I learn from her every day. We talk about, bounce things off every day because it's not the traditional looking up to date and on the CDC, and this is the answer you get.
If a patient comes into you, Beth, and has a complaint, and that cues you to refer, are there certain tests that you would test or certain results that you're looking for to where you know that somebody needs more than what are we looking for?
Certainly if somebody comes in with abdominal pain, or we're working up a gallbladder, or chronic diarrhea, IBS, IBD, abdominal bloating, there's a lot of, so serum testing we start with, and sometimes stool testing, it just depends, and start the journey. So where I always fall short, and where Shannon's program comes into play, is I am still, I still have constraints with insurance, meaning we have 30-minute appointments, and so imagine that's the time from you're being triaged in to you're being seen to charting, which often I take that extra time and I'm charting after just so I can spend that time with patients. But the nutritional education is a big part of what's going on for many people with their gut health. And so I will give them and write down on discharge, the snippets of, here's some resources, some different books I like, Keto Greens, Mediterranean diet, paleo, gluten elimination, things that I think are helpful, but it's a snippet and a Cliff Note version of what they really need. And what Shannon does is she's actually spending time, whether it's histamine intolerance or gluten sensitivity, or how do we fix the gut with 5 colors of the rainbow in foods, and how foods are medicinal. The foods have prebiotics, postbiotics, feed the gut microbiome with chlorophyll. She has the time to educate patients, and that's part of her structure, which is great. Very similar, but I think better to if I was gonna, send somebody to a nutritionist, right? So and she'll talk a little bit more about what she's doing and how she heals gut health. But that's a start. So we are not the kind of provider where, because this does happen, where we don't at least start a workup or ultrasound or CT if we need to, versus a lot of primary care offices just say, well, you have these complaints, I'll just refer them to, wouldn't you agree, I'll just refer to gastroenterology. They can do the whole workup, so then they're still getting the same workup, but the PCP doesn't do that. So,
right.
Yeah.
Okay.
I feel like you have so many great things to talk about. Do you want to start with the gut microbiome and talk about,
Yeah, I know, right?
It's like her cocaine crack a little bit, but in a good way. So here you go.
The microbiome is totally my jam. The reason is because it is so important, and it's a relatively new topic. I mean, people have been talking about it for a couple of decades, but the research is really going crazy on it right now. And so the microbiome is the trillions of bacteria, viruses, parasites, and fungi, yeasts, that live in your large intestine. They live other places too, your oral cavity, your skin, your vagina, lots of different places. Even in your stomach and your small intestine, they naturally have organisms in them. But the one that we're going to talk about today is the gut microbiome. So it's primarily in the large intestine. And collectively, these organisms create what we now refer to as an organ. And they weigh about the same as the brain. They weigh 3 to 7 pounds depending on the person. You've got to wonder why you as a person would expend the energy to carry that around. It's like carrying a purse around all day, right? Why would you spend the energy to do that? And the answer is because it's incredibly important to your whole body health. The organisms that make up your microbiome do things for us that we cannot do ourselves. So we have about 17,000 enzymes that we use to convert our food into vitamins, into hormones, into short-chain fatty acids that calm inflammation. But bacteria have another 60,000. They can make our food into things that we cannot make it into. And we need them to do that to be a fully functioning, healthy organism. So for example, they turn our food into 90% of the serotonin in our bodies, which is the happiness hormone. 50% of the dopamine, which is the reward hormone, what we taste when we eat, or how we feel when we eat cookies, what we release when we orgasm. Mm-hmm. Anyway, it's the reward hormone.
Yeah.
And so, and the way that we eat in America right now is we're not optimizing our microbiome. So the way to think about it is, it's like you have a pet inside of you, and it's your job to feed that pet. And if you feed it well, it will make all these things for you, and you don't even have to think about it. And so you want your pet to be able to do a lot of jobs for you, right? And so you have to feed it a lot of different things so it can do all of those different jobs. So we talk about a diversity of diet to support a diversity of different bacteria in your microbiome to get you a diversity of healthy products in the end. And so to do that, we talk about eating the rainbow, which is just looking at your plate and seeing lots of different colors. If you do that, assuming they're natural colors, you're going to be getting a lot of plants. And if you want to get down into the weeds a little bit, we say 5 plants per meal, which sounds like a lot, but it's really not. I'll tell you how to hack it. Or 30 plants per week. And so 5 plants at a sitting can be a couple tablespoons of salsa alongside your scrambled eggs in the morning, And lots of things, because it's not serving sizes. I'm not talking about serving sizes, it's just a diversity of different plants. And people don't realize that coffee is a plant because it has all kinds of antioxidants in it. Tea is a plant, peanut butter is a plant, chia seeds are a plant, chocolate is a plant.
They are amazing food properties. Coffee is really good for you, but just make sure that you're buying a good organic pure coffee bean, because coffee as a whole, multiple different brands I won't mention, have a lot of pesticides and herbicides. And so when she's completely right, we order a coffee online that is from Costa Rica, that's organic, it's delicious, but
what's the brand?
Purity Coffee is the one we use, yeah. But anyway, just to mention so just make sure, and you hear that a lot in my practice, that where you're getting your food from is also as equally important. So plants grown in mineral-rich soil, because there's a lot of good food properties. Coffee beans, teas, things that are organic are going to not have the pesticides and herbicides that our body looks at like a virus, right?
Yeah. Do you notice a significant difference in organic? Organic matters.
Organic does matter.
Yeah. Organic matters. You're not going to see it, but you might feel it in your pocketbook, but it makes a big difference.
It does.
Yeah.
But I will tell you, I recognize that eating organic is more expensive. And so when that's an issue, you can go to EWG, the Environmental Working Group. I'm pretty sure it's ewg.org. And every year they update the Clean 15 and the Dirty Dozen. So these are 15 things that you can feel okay about eating conventional, and a dozen things that usually almost always include strawberries, and oats are a big one. Because I didn't know this, but oats are often grown in damp environments, and they spray the oats after they've harvested them with Roundup. I don't think we're supposed to say that. I think we're supposed to say glyphosate.
We are 100% to say that, yes.
But yeah, because it
We're
dries
putting
them
poison.
out.
We're putting poison.
Yeah, and
in
I
our
read a
gut.
study
Yeah.
that it's almost more important to purchase organic grains than fruit, because the organic grains you can't wash off, you
That's
can't.
fair.
That's right. And I'm all about supporting farmers. I love farmers. I grew up in Lancaster County, Pennsylvania. If you have great farmers that are not using a lot of the different substances we're talking about, it doesn't necessarily have to be organic, but just, they have a good ecosystem where free range cows and chickens and, chickens should be eating worms, and they should be eating bugs, and this gives omegas to eggs. So eggs have great properties for vitamin A and E, and even cholesterol in good forms is good for us. So it's the right food sources. I often have this conversation because people think, well, if I choose a Chick-fil-A sandwich over the Chick-fil-A salad, am I eating a salad? It's still good, even if it's restaurant born. There's a good chance that the lettuce has very little good property and whatnot. So it just really does matter your food sources. It's what we're trying to change and what we do. Yeah, the glycophosphates are a real thing. That's a real problem. If anybody out there wants to Google and read about it, we don't have enough time to go on about it today, but the literature's out there for sure.
And the thing is that the everything has a microbiome. Everything you and I
100%.
do. The soil has a microbiome, and it contributes microbes to the produce that you pick.
That's right.
And so when they go and they blast these factory farms with all kinds of pesticides, and Roundup chelates binds the important minerals in the soil, they don't get transferred to the food, so they don't get into you. So that's another reason to be careful about your food.
That's right.
Eat local, eat small is always best.
Yeah, of course. Yeah. We were going with 5 colors of the rainbow, and how you do this. So coffee, we started with coffee, tea. These are plants, and so for breakfast, and
So it can be almost like a little game to figure out how you can get more diversity of plants. And I don't care if you eat meat. I personally don't, because my Instagram feed is full of for grass puppies and and Pickles the pig who likes belly rubs. But but you do you. It's not about excluding anything. It's about adding plants to your diet. And I have a few hacks that I love. Like I love compound foods like smoothies and smoothie bowls, because you can just add so many things to it. I like granola. Like I go and buy store-bought granola, something that's clean, that I like what's on the label. And then I take it home and add all kinds of stuff to it.
that's a great idea.
Yeah.
Yogurts, and you could add your fruit. You could sprinkle it even with some.
I just put it in like a big Tupperware thing, and then that's my granola.
That's awesome. Yeah. That's right. You like salsa. Salsa's a big one for you
Salsa's
because
a
there's
big
a
one.
lot of different
Love that.
varieties. Yeah. I always talk about salads, and it's how
Salads.
I pack my food when I go to work, and we're there long days, and my salad has a ton of colors in it. My staff is always laughing and asking me to make some for them. But that's a great way to get 5 colors in. You have a big salad, right?
Yep.
So that's another good. Yeah.
And it doesn't matter that it does not at all have to be a serving, because if you think about it, you're feeding teeny tiny little organisms. They're microscopic, so you give them a blueberry and they're like,
Right.
Yeah. They are jumping. Your little microbiome is jumping up and down and screaming. Yep. So Shannon, from the 5 colors of the rainbow a day, and I do think there were a couple questions on prebiotics, postbiotics. Let's talk about some food sources outside of the traditional taking a probiotic. What would you say some foods are for prebiotics, postbiotics, regular biotics that are going to help your gut microbiome?
So prebiotic really just means food. So in my opinion, prebiotics are nothing more than marketing. You don't need a prebiotic per se. If you are taking your probiotic with food, then it's getting what it needs. They often will package it with a little bit of, you know, the stuff that's in almonds, for instance, galacto-oligosaccharides. That's a favorite prebiotic. That's fine.
And
That's
if anyone can spell that, they win today.
Yeah, I'm sure I know.
Yes, go ahead.
Well, and I think that's part of it. You know, they want to make it seem really, really confusing and intimidating, so that you'll just buy the product. And you can, that's fine. It's not going to hurt you. But
Sure.
a prebiotic is very simply something that you give the probiotic to eat. Okay. And then a probiotic is just a good bacteria, and any probiotic on the market is going to be good for you by definition. Here's the thing about probiotics. They may or may not work, okay? The data is really soft for specific indications. For instance, if you have IBS, there are a couple of bacteria that you can buy that have shown to help. Or if you have ulcerative colitis, there's a formulation that data shows helps. But in general, what your attitude should just be is, I'm going to take the probiotic that fits my budget, that has the most beneficial strains, and they'll have it all over the front of the package, in the most billions, okay? And that's your rule. I have one that I really love. It's called Garden of Life. It's widely available. I like the Ultimate Billions, because it does have billions. I think it's 10 billion. They call them CFUs, colony forming units. It's available at Whole Foods, at shelf stable, and they do not stay in your system. Probably because the formulations are not specific enough. They're not the specific strains that reside in the human gut. Like when for the strains that live in us have, you know, it'd be like Sharon with a million middle names Smith. But in your formulation of probiotic, you just get Sharon Smith.
Right.
Okay. But as they pass through you, they will do good things to the good food that you're eating. And the most important prebiotic is fiber.
And some pre-fibers, would you say avocado can be a good pre-fiber?
Absolutely.
Bananas are
yes,
good.
especially on the greener side.
How about some other what would you talk about with fiber, pre-fiber?
It is anything that is a plant, anything. But some of my favorites that were surprising to me are greener bananas, because they just have more of the resistant starch. I love mashed potatoes. Okay, sweet potatoes. I think you called me this on this one time when I was talking about it. Yeah, sweet potatoes are better because they have a color. But even mashed potatoes, especially now when I go to a restaurant, I order mashed potatoes because I know they made them earlier in the day. They probably heated them up for me. Maybe they made them yesterday and then heated them and cooled them a couple of times. That makes that starch chain longer, which makes it survive longer and get to my colon and feed my microbiome, so I can have my mashed potatoes and benefit from them too.
And I can say, after many dinners with Shannon, she does love some mashed potatoes. You know, most people do like Idaho potatoes or Yukon Gold potatoes because they're sweet. They taste better than, say, red new potatoes. They all have good properties. A way to make mashed potatoes even healthier is heat up some cauliflower or use cauliflower rice. You have another plant, mash it all in there. You can throw in a good, again, choose your cheese to be, if dairy doesn't seem to affect your gut or cause bloating or whatnot, just choose a good organic cheese that's from cow's milk and it's real, not Velveeta or Kraft. And so throw some cheese in there, throw some good butter, olive oil, little sea salt. I mean, there's great ways to make it healthy. So yeah, mashed potatoes are good.
On the subject of mashed potatoes, which I never knew we were going to get here, with skin.
Yeah. Always with skin if you can.
So
anything
we
with
mash
skin,
potatoes with skin. Because that's
100%.
always,
That's a good point, Kendra.
Yep.
Yeah.
Skins and seeds are going to have fiber in them. Yep,
Okay.
they're good.
Yeah.
Any post-biotic foods you want to talk about, or just?
So postbiotics are the end product of the bacterial action on the food. And so one of my favorite ways to get all three, like if you want to be a superstar and just knock it out of the park, is to eat those fermented foods, like sauerkraut, for example. Sauerkraut, kimchi, kombucha, kefir. For using sauerkraut as an example, the cabbage is your prebiotic, and you grow lots of those probiotics, and those have been used since the beginning of time. So they're often in spore form, so they survive the acid of the stomach, and they're more likely to get to the colon. And then they come packaged with the postbiotic. The broth in the sauerkraut contains all kinds of postbiotics, so you're getting all three.
Yeah.
So if you don't mind the tang, and you can make those at home, they're so easy. I mean, there's a long tradition of making those at home. it's almost impossible to get food poisoning from them, you know.
Which is like
And even
shocking.
sauerkraut, if you just leave it in the fridge and do a tablespoon a day of sauerkraut, it has great fermented properties. Speaking of fermentation, let's go from here to one of the, I feel, you elaborate, one of the probably most misdiagnosis in the medical community, or just providers not really knowing or understanding, is histamine intolerance. And I would love Shannon to talk a little bit more about it. We talk about it in my practice, but fermented foods tend to bother patients who have histamine intolerance. And from histamine intolerance, you might even want to talk a little bit about EOE. I have quite a few patients with EOE, so I'll let you elaborate. I do,
Okay. Yeah. So one of my favorite sayings is IBS is a bunch of BS.
Oh, yes.
That's one of my mantras. And that's
We should have
because
shirts made that IBS
I know.
is just a bunch of BS.
we really
Let's do
should.
that. That's right.
I would love to do that actually.
Yeah.
Because irritable bowel syndrome is what IBS stands for, and all it says is that you have symptoms. And so what happens normally is you come to the gastroenterologist and you complain of diarrhea or constipation, abdominal pain, things like that. And the doctor does a bunch of tests on you that cost a lot of money. And then if they're all negative, they tell you you just have IBS. Be glad it's nothing worse. But that feels terrible to patients. It feels very dismissive because the symptoms of IBS are debilitating. You know, they can be very unpredictable. They can cause a lot of anxiety about whether they're going to pop up or not. They can cause a lot of shame, anxiety, depression, because they can cause people to self-isolate, you know, and they make people, for instance, turn down invitations to events that should be joyful. You know, we should be able to share over food, and people just get very anxious because they're not sure what symptoms are going to pop up at these events or after they eat. And when you dig a little bit deeper and you spend a little bit more time talking to people, the reality of it is that IBS diarrhea type symptoms, there are about a dozen causes of them. And for IBS constipation type, there are about a half a dozen causes of those symptoms. And so when I'm talking to a patient, when I'm spending the hour with them and they're in for IBS, I'm mentally checking through all of those possible diagnoses, because I don't want to just tell you you have IBS and here control your symptoms. I want to figure out why you have IBS symptoms. And one of those, a big one that's overlooked a lot of the time, is histamine intolerance. So histamine is a molecule that is very important for normal health, and we all have histamine receptors throughout our body. We know about them when we get exposed to allergens like ragweed or whatever, and our nose starts running, and we take an antihistamine. That's to block those receptors and calm down those symptoms. But most of our histamine receptors are actually in our gut. And so histamine intolerance can be thought of a little bit like lactose intolerance. You get overwhelmed, your system gets overwhelmed by too much of the histamine. And the histamine can come from the foods that you're eating. It can come from dysbiosis, which is an imbalance in your microbiome, too many bad bacteria. The bad bacteria can actually make histamine. And then it hits all of those receptors and it causes symptoms. And so one of the ways that I screen for it is I ask people, when you eat certain high histamine foods like chocolate, peanut butter, alcohol, cheese, salami, fermented foods, probiotics, lunch meat, that's a big one. Tuna's a huge one. Do you get symptoms of stuffiness? Do you get a rash? And you don't have to have all of these. It's just, you could have any of these. You get a rash or an itchy rash. You get headaches. You get palpitations. Do you have painful periods?
The flushing, a lot of folks with alcohol, everybody out there probably knows somebody where they get red and flushed when they drink.
So that's prevalent in Asians. So David, that's like the Asian flush, like if you drink or eat certain things.
Yes.
Yeah, okay.
I often wonder though, because I have a few folks like that in our practice that are Asian and just say, it's the Asian
flush,
it's the Asian flush, but I often wonder if they really have is it really that, or is there an element of histamine intolerance? But anyway, go ahead,
Well, and leftovers are a big cause of histamine, because any bacterial action on food causes histamine production. And so I used to all the time in my former career, I used to ask people as a screen for IBS, can you eat food, can you eat something for dinner and be fine, but then the next day you can't tolerate it, you get terrible diarrhea and pain? And they're like, yes. And it'll be like IBS, classic symptom of IBS. Maybe, but not necessarily. It can be a sign of histamine intolerance. And so the way that we treat histamine intolerance, there's no test for it.
Yeah.
It's all based on history.
Yeah.
So you've got to get a good history. And the way that we do it is we put them on a histamine-free diet or a low histamine diet. You can't completely knock it out. And there's some good apps that you can use to help guide you with that. Or you can see a nutritionist who can help too. But you go on that for 2 to 4 weeks. We use histamine blockers. So those are things like Zyrtec or Claritin and Pepsid.
And Singulair would probably be good too, right?
Singulair,
Yeah.
yep. You can use
Yes, it's a
Singulair
mast
as
cell
well.
activator. Yeah.
And then there's an enzyme that you can actually get on Amazon, and it's like taking Lactaid, but it's for histamine intolerance. So we get people symptom free for a couple of weeks, and then we start slowly working things back in. And that's one thing I want to highlight is that we as gastroenterologists know that when we put people on restrictive diets, we can give them eating disorders. And so the goal of any diet is not to park you there and, okay, this is where you live. It's a diagnostic trial. We're seeing, do you get better when you avoid the things that we know are in this food?
Yeah.
And then let's slowly work it back in and get to a place where you're eating normally, because we want you to eat a diversity of foods.
When the gut is blown, and we're just going to use the word leaky gut, and the gut microbiome is not well, you'll often hear me talk about a gluten, dairy, and added sugar elimination diet to start, very similar to what Shannon's talking about. Low-FODMAP mapping is great too, but it's not sustainable long-term. But any metabolic detoxing is always good. It's good for the gut, it's good for the liver. We talk a lot about anti-inflammatory foods, very similar to low histamine foods. But regardless of, it doesn't mean forever, but you're working on detoxing the gut, cleaning it up, fixing the gut microbiome. And once you do that, then you can add foods back in, and they may not irritate you as much as they did because your gut is well. So it's, you have these, we give you these parameters, and I often get the deer in the headlight when you say gluten, dairy, and sugar. But it's honestly, I don't think it's as hard as it sounds. But anyway,
Yes. A little bit of planning.
Yeah, no, but it's true,
People
because
are
I
so
always
excited.
picture it as like a deep clean.
That's right.
The kind you move furniture and you get under things, but that furniture can come back into the room.
That's right.
Like,
It's not a
yeah.
debilitating.
Excellent.
Yeah.
It's a great metaphor.
So what we're trying to do, back to what Shannon and I do, and we feel like we're doing pretty well, is getting to the root cause, right? Where you're fixing it, if you're not putting a Band-Aid on. And then again, we're foodies. We love wine. We like fermented foods. We love all palettes of food. We journeyed to Costa Rica and just did nothing but ate good food, right?
Yeah, we did.
And so it's part of living. You have one life to live it well. It's just choosing the good properties. And then when you do come into an insult where you're eating out and you have bad bread, or you have food, the next day you don't feel like a trash can and can't get off the couch. So because your gut health, it can repair. You have more oxidative stress repair. So yeah. But off of histamine intolerance, EOE is another very common. I'm seeing it more and more year after year. So maybe talk a little bit about the eosinophilic reaction.
Yeah, so EOE is another entity that is undergoing a lot of research. There's actually I think UNC is a Center for Excellence. I'll plug for UNC.
Yeah.
They're doing a lot of research, but it can be either airborne allergens or food allergens that trigger this eosinophilic, which is response. And eosinophils are a type of white blood cell, and they're involved in allergy and parasite responses. And so in this case, it's allergy. And what you get is a crowding of the wall of the esophagus, the swallowing tube, with these white blood cells. And it causes swelling toward the middle. So the caliber, the internal width or diameter, I guess, of the esophagus gets smaller. It's most common in young men or in men. And you have to diagnose it with an upper endoscopy with biopsies. And there's a lot of research on treatments for it. One is avoidance of allergens. And so the most common allergen is dairy. And a study just came out that single food elimination is just as effective as 6 food elimination.
Interesting.
Diets. Yeah.
Very cool.
And it's dairy is the one that you want to eliminate first. But people usually need additional therapy for it. And so we use steroids, and the swallowed steroids are just as effective as the systemic steroids, but they don't have all the side effects. So we're talking about like puffers that you would use for asthma, but instead of breathing them in, you swallow them, and you need to be instructed on how to do that. Or you can use the kind of steroid that people use in their nebulizer. And instead of using it in the breathing machine, you crack it open and you mix it with maple syrup or applesauce or Splenda. I don't like artificial sweeteners, so I don't use Splenda. But and then it coats. No, we do not. They're the devil. And then it coats the esophagus, and it makes it kind of breaks up the party, makes everybody go away. But the reason that this is important is because over time, that continued inflammation and allergic response can lead to scarring in the esophagus. So that over decades, you can be left with a lead pipe esophagus, and it won't do that normal snake-like contraction of moving food down. So that's what we're trying to avoid. And the other reason is because when your esophagus doesn't work well, or when it's swollen, you can get food stuck. And that's a medical emergency. You end up going, I don't know why, but you always end up in the ER at midnight, and then you're very uncomfortable until the next morning when somebody like me comes in and gets it down for you.
Bolus, yeah. I used to see that all the time in the ER, food bolus, all the time. And you're just miserable if you have EOE. Like you have a limited amount of foods you can eat that your body will tolerate. Many of my patients are so thin because they can't, I mean, you're just miserable, so.
But there are treatments, and there's actually a new one out, Dupixent, which is an interleukin-15 blocker, I think, and it's an injectable, so.
Nice, so a new treatment. So EOE. And then two others that are big hype questions. I think we saw some questions come across about it. I get it all the time in my practice. Even people calling in asking, do we do SIBO testing? A lot of people don't even know about SIFO, S-I-F-O, because more and more people are becoming aware of small intestinal bacterial overgrowth. We'll just talk about that briefly. I think Shannon and I are both in professional agreement that neither of us really do the SIBO testing because there are a lot of false positives and negatives. It's a long test, 3 hours, I think, breath test. And if we think we're talking about fixing the gut microbiome, because if you have small intestinal bacterial overgrowth, you're not well. And you can treat with rifaximin if insurance will cover it. But I'll let you talk a little bit about SIBO and SIFO, very different, but some people listening may have the aha moment of what's been going on with them.
So SIBO is small intestinal bacterial overgrowth, and basically what it means is that the microbiome that we've been talking about in the colon, the bacteria creep their way up into the small intestine where they shouldn't be, because that's where you're digesting your food, that's where you're absorbing your nutrients. And so if the bacteria get up there, they have lots to eat and they go bonkers and they overgrow, and then you get symptoms, because anytime bacteria eat, they make gas, right? And that causes stretch, which causes pain, and they create irritating substances that will cause diarrhea, and in some cases constipation, but for simplicity, we'll talk about the diarrhea type. So I do some SIBO testing. You need someone to interpret it for you though, and the only way to do SIBO testing is with a breath test. You cannot tell with a blood or a stool test if you have SIBO, because it's a location issue. It can be all the same bacteria. Any of the bacteria that are supposed to be in the large intestine have come up into the small intestine. And it is treatable with rifaximin, and in fact, anybody who comes in with diarrhea and doesn't have another diagnosis like celiac or Crohn's disease, who we call just IBS,
or IBD, IBS, IBD.
10% of those people are helped by rifaximin because we're killing something. So we think that there's a lot of SIBO that goes undiagnosed, and it's just called IBS.
So if you don't eat the rainbow and you're not doing a probiotic, will you get SIBO?
You can, because the things that cause SIBO are things like, they're usually things that interfere with normal sweeping out of the small intestine. So, and I'd love to talk about bloating if we can before we.
Yeah,
that's a huge question.
Keep out on bloating. Okay,
yeah,
I love bloating. I used to hate it, but now I love it. Because it's one of those areas where it's so common and you can really help people.
I feel like 99.9% it's a common chief complaint in my office.
Yes, bloating.
100%. It's the first thing you ask, how's gut health? I'm bloated. Yeah, go ahead.
So there's something called the MMC, the migrating motor complex, and it is like a street cleaner, sweeping, wave of peristalsis that sweeps from your small intestine all the way to your rectum every 90 minutes. And it kicks in 90 minutes after the last thing that you ate. And so anything that interferes with that, like pain medications, because they just slow down everything, thyroid problem, anything that, scar tissue from any abdominal surgery. You could have had a hysterectomy and you've just got these gossamer bands of scar tissue in your abdomen that cause kinks in your small intestine, and therefore that wave can't propagate all the way along the way it needs to. Some people are just born or develop a pouch in the small intestine called a diverticulum where bacteria can kind of hang out. They don't get swept out. And so that's like their little safe house where they can go forth and populate your small intestine. So there are lots of reasons why you might have SIBO that have nothing to do with your diet per se.
Yep. Antibiotic use too.
Yes, totally.
I mean, it used to be all we would talk about years ago in medicine was C. diff colitis. I feel as though SIBO is overpassing C. diff colitis from over antibiotic use.
SIFO can be
SIFO, let's talk about SIFO, yes.
Okay, so SIFO is small intestinal fungal overgrowth. And this is, again, one where SIBO you can diagnose if you want to. You can do a breath test. SIFO you cannot. There's no breath test.
Where do you send your folks to for SIBO? Are you doing it in your office or are you going to the lab?
No, I order it online.
Okay.
Yeah.
Which test are you using?
Trio Smart.
Okay.
Because they test for hydrogen overgrowth, methane overgrowth, and hydrogen sulfide overgrowth.
Okay.
So all three.
All right, well, I learned something new today. We'll talk later.
Okay.
I'm educated.
It requires a prescription, and use lactulose as your substrate, not glucose.
Okay. Okay.
But
all right.
that's
very good. Okay.
So SIBO is the same kind of thing, but you get fungal or yeast overgrowth in your small intestine, and you get at the diagnosis with just a really good history. So you ask people, I ask people, do you have a sweets monster inside of you? Meaning, like, if you crack the seal on a bag of cookies, is that whole bag going down? You know, do you do you really love sweets and you have to keep them out of the house? Do you get chronic yeast infections, vaginal, or like that red rash that we sometimes get under our breasts or in the folds of our fat or groin areas?
And or oral
thrush.
Candida, yeah.
Do you get those, the nail infections like under your toes, the chronic yeast infections of your toes? And if the answers to all those are yes, then I treat with fluconazole.
So diflucan, fluconazole.
Yep.
Many women out there will know that from yeast infections.
Yep.
Yeah.
And the
But
difference
it's a lengthy course.
It's 90 days.
Yeah, 90 days.
It's 90 days,
Yeah.
but it makes such a difference. Oh, and here's the really interesting thing about SIBO. The yeasts that grow are the same thing as brewer's yeast. They actually create alcohol in your gut. So one of the questions I ask is, do you have brain fog? You know, and what I'm really asking is, are you a little bit fuzzy all the time because you've got alcohol in your system? Yeah.
And not a good party in your gut.
No,
Yeah.
And the other thing is, sometimes these people will have high tolerance to alcohol. Like, they're those little ladies who can drink everybody else under the table because their enzymes to handle alcohol are always wrapped up from these yeasts.
Yeah.
And it makes such a difference when you treat them.
What would you like to talk about with bloating?
Oh, bloating.
Yeah.
There are a couple of different kinds of bloating, and but the most common kind is the kind that we call functional bloating. And that's when people wake up and their tummies are flat, and then as the day goes by, like breakfast is usually okay, but after lunch and they sit back down, they start to feel the pressures building again. And after dinner, when they're wanting to, chill on the couch and Netflix, their bellies are huge. They often will bring in pictures of a side view with it looking pregnant, with their tummies looking pregnant. They are not complaining of gas. This is not flatulence, but there's a lot of pressure, and they feel like if they had a pen and they could poke it, they would. They go to bed miserable. They wake up with a flat tummy again. Okay. I always screen to make sure that constipation is not a part of this, because constipation can be there and people don't realize it.
That's right.
Even I can get fooled by taking a history for constipation. You can be full of poop but still be pooping every day. So that's the first thing, is rule that out. But oftentimes what's happening with this functional bloating is that they're either overwhelming their system a bit by eating too much at one sitting. So their system is always processing the food, and they never get a chance for that MMC, that major migrating complex. I always forget what the
It's a tongue twister.
Yeah, that peristaltic wave to kick in and start sweeping the system clean. The other reasons that people graze. you know, and again, the MMC never kicks in.
Intermittent fasting is helpful for that too.
It totally is.
Yeah,
It gives
so-
you time to have more, because that MMC kicks in 90 minutes after the last thing that you eat or drink, and then it repeats every 90 minutes. And that's why when you go to bed, you've got several cycles of that every night, and you wake up flat.
Yeah.
So that can be a huge aha moment. And the other thing is, we don't move enough lots of times, and so just putting in just a simple 15-minute stroll after dinner will help with motility to get things moving through you better.
Should you poop after every meal?
No.
No.
So if that's working every 90 minutes, but it's not fully ready to...
Yeah, and your colon is a reservoir. That's where you're kind of holding the food that you've already digested, and that's where your microbiome is doing its magic. But normal pooping is anything from 3 times a day to once every 3 days, and it just depends on how you feel. And everybody is different.
Yeah.
Men tend to poop like clockwork and brag about it, but women tend to be more constipated.
Yeah.
Yeah.
Is that hormone related?
Probably.
I think progesterone has a little bit of a play because it's kind of very similar to when you have, you know, the week of menses.
Yeah.
Your progesterone goes high, right? So you have a surge of progesterone. So women will often have some, you know, loose stools or diarrhea during that week of menstruation. And so progesterone, it relaxes the smooth lining in the intestine, so a little bit. And two, you know, progesterone for women with, you know, other causes like frequent UTIs and stuff. But again, frequent UTIs, we often go to the gut microbiome because it's not a normal process. And the traditional knee-jerk reflex is you know, okay, you have a couple of UTIs, go to the urologist, they do a cystoscopy and it's normal, and it's back to, well, why am I having... So then what traditional medicine does is here's an antibiotic to take right after intercourse or with onset, which is, again, it's a vicious hamster wheel cycle. More antibiotics are going to worsen the gut microbiome to fixing the gut.
That's right.
So I think in all we've just talked about, and it's probably time to get to questions, is just of how important this is the biggest organ we have, and why we talk about it so much in our practice, and why we have our expert, Dr. Shannon Scholl, that's done a great job at talking about some of the key points I get questions for every day, and how to fix it.
So one that will follow smoothly in this is it, can you take a probiotic forever? Is there a disadvantage from not ever going off of it, or that should just be a permanent thing? There's no penalty.
It's up to you. I don't use a probiotic because I've optimized my diet, but I'm not against it. And I often tell people to go on them because I want them to have as many good bacteria as I can get in them, eating whatever plants they're getting into them. So especially when I'm teaching them how to eat more plants, I want them to have more good guys in their gut. And so there's, by definition, a probiotic is good for your health.
Yeah.
Okay.
And you have to remember too, by the time
Unless you have histamine intolerance, and then they can actually create histamine and be bad.
Yeah. By the time they're seeing us and we're talking about all these conditions and poor gut health, their gut health is not well.
Right.
And so,
most people says that.
So the probiotics are just part of the process of repair, in addition to other, you know, all the other things we talked about, because it takes some time, and it's human nature. If you're not feeling, you know, we all want things to happen quick. We try to explain realistic expectations, but when people don't feel good and they're making diet changes and they still come back 3 to 4 weeks later, then they're just falling back off the wagon wheel. But if you fix your gut and your gut microbiome as well, then you may not need probiotics anymore.
Another one here is, and you've touched on variety and the importance of variety, but what if you just have a really limited palate?
So a couple of things about that. One is your microbiome actually guides your cravings. So you can train your microbiome. So it may be that you're not really a kale lover. You don't love kale, but if you begin to eat kale, and I would always recommend that you start in small quantities, because if you're not a kale lover, you don't have a lot of kale eaters in your gut right now.
And you get a lot of gas.
Yes, you can get a lot of gas, which causes a lot of pain. You can even get diarrhea. Here's a little tip though, is to eat a little of the raw kale before you cook it, because everything, again, has a microbiome.
Mhm.
That kale is coming coated with, and everybody says it's gross, but it's not as natural. It's coming coated with the bacteria and the yeast and everything else that are needed to break it down. So eat a little bit of that raw and seed yourself with it, and then slowly increase the amount of kale that you eat. And before you know it, you'll find yourself going, I'm really craving that kale Caesar salad from Happy and Hale or whatever.
Yeah, it's good.
Yeah.
That one's good.
Yeah.
And another sorry to interrupt,
No,
but
yeah.
another trick I talk with patients about that are really, they're limited. I'll get this sometimes where they hate all vegetables. I mean, you've got to get the greens in. You just have to. You have to get cruciferous vegetables. You have to get greens in. You have to have chlorophylls. And so doing like a green shake or a smoothie and sweeten it with honey or like an
Or
almond
dates.
milk or dates. I mean, finding ways to make it work is a really good tool, because if you are just in the, I get chicken a lot, chicken, potatoes, and everybody thinks that having potatoes every day, having potatoes too much can be a bad thing, right? Because it also converts into sugar, and so it's sometimes it's mixing, finding a mix, or like you mentioned, the smoothie bowls are a great way, and you could throw quinoa in there, which is a great, protein. I mean, so there's just good ways, but making a green shake for lunch is a good way to do it.
And I always would prefer the smoothie or the shake over the juice, because the fiber
agree.
is really important.
Yeah, I agree.
Are there certain brands of probiotics or supplements or things that you recommend? You said something you could get off of Amazon. Like, are there, who do we trust?
Yeah, I mean, I like Garden of Life for my probiotics.
And that's Whole Foods, Sprouts. I think Wegmans carries that too. So that's, you can get that a lot of
Very
places.
widely accessible.
Yeah. I like Metagenics and I like Megaspore. Those are my two go-to.
Megaspore biotic. Yeah.
I like that one too. And Metagenics has different, what I like about what I talk about Metagenics a lot, but I just really like the science. I mean, you can go on their website and you can look at data that's been done, and it's just kind of been telling on things you do in practice where people, it's rare for somebody not to start a probiotic and they almost immediately notice, if they're on the right one, that the bloating ceases somewhat. But they have different probiotics for different things. Like there's a control balance for women who are having a lot of UTI, yeast issues. There's one that's even a broader spectrum than the ultraflora spectrum we use so much, but just different. They have different probiotics. So I listened to a podcast once about this because there are so many and there's so much marketing that probiotics, it's very similar to food. All food is not equal. You cannot compare fried chicken and Coke with a salad that's 5 colors of the rainbow. It's the same way with probiotics. You can't compare, a Walgreens brand with a good medical grade probiotic. And so if it is a lot cheaper, there's usually a reason for that. And so it's just really, I think, doing your homework on that one, because different providers have different preference on them, I think.
Yeah.
When you say.
And they are largely unregulated, and there is
there's
no
so
chain
many.
of custody. You have no idea if your refrigerated probiotic spent 2 days on a loading dock in 90-degree heat. You really have no idea. But it is possible too that you don't need a viable probiotic to get some benefit. It may be that just the shape of the bacteria tells your immune system to calm down. Like there are good guys in here, we don't need to be upset.
So are there patients that you see that you are like, okay, you need a gut cleanse? Or is your gut cleanse through food?
Yeah, I don't do gut cleanses. I'm a little bit leery of the word cleanse in general. Supplements are, natural, these cleanses and things are another area where they're just not regulated. And there are active compounds in there, I mean, they're like, I was telling Beth before we started, I'll never forget a lady that I met during residency who had hepatitis B, and she cured it with Chinese herbs, but she cured it by killing her liver. She was there waiting for a liver transplant. I mean, they are active compounds, and a lot of them are liver toxic. So now I don't do cleanses. Now, if we're talking about somebody who's really constipated, I always talk about a short-term goal or a short-term remedy. I call that the sprint, and then our long-term strategy, which is our marathon, and then I always give them something as a rescue in the middle if their symptoms pop up.
What is a rescue?
Rescue is like if we're talking about constipation and you haven't pooped in 3 days and you're getting bloated and uncomfortable, here's what I want you to use for that.
Yep.
And we were talking earlier too, be very careful about, and we would agree on this, parasite and these mold detoxes, because it's out of our box, but I've had a couple patients come in, liver enzymes are elevated. I mean, if your immune system is functioning well, it's, you know, we are exposed to molds all day, every day. It's not that massive mold toxicity doesn't happen. So if somebody's working under black mold, that's a problem, or if they're living with it. But there's just a lot of those kind of remedies out there that are marketed and may not really be safe. And the parasite situation, you're just not going to see it as much as I think it's out there.
You need to know exactly what you're treating, and even when I diagnose someone with parasites, I want to think about whether we treat it or not, because there are some, like Blastocystis hominis is a parasite that is involved or is implicated in diarrhea, but it's also important for weight regulation, we think. So
and where that gets dangerous, and I've seen this in my practice, where folks will come in with a PCR test for parasites from another provider, and we have, as we're talking about, we have bacteria all over our gut flora that is important, and we as a society are eradicating really good bacteria, and so we, I think, are sometimes doing more damage. You just have to be careful with it. There was a question about it, and just be careful who you're talking to and who's treating you, and just to make sure you're going down that right path.
Yeah, and the difference is, I mean, if you're a sushi eater or you just came back from Asia and you're seeing things wiggling in the toilet, that parasite I'll treat every day. But normally,
Yes.
I'm gonna die.
Creatures, we'll treat those.
Normally you don't have symptoms from those.
Right.
Yeah.
So a parasite protocol per se.
Yeah, be very careful. And mold's the other one. Yeah.
So we'll end it with a peptide question, which is my own, because it always goes back to peptides for me. Why did those two peptides help my gut?
The BPC 157
and CJC 1295.
Yeah. So BPC 157, we'll just revisit that briefly. It's known as the Wolverine peptide. It's an immune modulator. There's different immune modulating peptides that work specifically. It's one of its properties. It works in the gut lining. So when you did injectable BPC, I do injectable BPC. Shannon, I've given you oral BPC. When I have patients who have a lot of GI chronic issues, or had a patient not too long ago who has had chronic colitis for the good portion of her life and is on almost all plants and has been to every specialist and whatnot, and the BPC 157, when you load it, it heals the gut lining. Her symptoms were gone, and so she can now live normally. So yeah, it's just part of what that peptide does. And I don't know the biochemistry behind it. TB4 is another one that if I have somebody with immune issues and I need to induce active killer cells, which are the T4 cells, TB4 frag is an amazing immune modulator. So but BPC 157, it's a go-to so it's probably the most go-to peptide that we use for everything. It helps with energy, it helps with the gut, it helps with weight, it helps with
PMS symptoms.
PMS. And CJC epirelin probably helped a little bit more for PMS symptoms and hormones, because you are stimulating the growth factor with CJC epirelin. And CJC epirelin, because that's what you're doing, is you're turning back signals back on. CJC epirelin helps other peptides work better. So that's why I typically wouldn't ever use CJC epirelin by itself, but that's one that really helps more with skin and anti-aging. Both are regenerative peptides. But yeah, oral BPC, I'm using a lot more oral BPC for my folks who have really bad GI issues, and at least to load them for now until we get to that next process. Yeah. I just super excited for where Shannon is going with this journey, and I can't wait for what we're talking about in 5 years, and as we are both exploring how to help patients in the new arena of regenerative medicine, and so how to live to be 108 and not be crippled with disease and live well, and you're given one life, right?
And can we talk about your gut club a little bit before
Yeah.
we roll out?
Yeah, so, you know, when all day, every day, I talk about microbiome, and sometimes people are really jacked to hear about it, and other times their eyes glass over. And so I realized I wanted to be in a room full of people who wanted to hear what I had to say. So I started this online course. It's 3 months long, which offers the opportunity to really transform your gut. And it's geared toward women who have IBS diarrhea type, because there's so much, you know, we go through all of it. We go through those dozen or more things and get to the root cause, and then I lead them through FODMAP restriction and then reintroduction, and then teach them all about the microbiome. And I'm doing that, I haven't decided how often, but the next one is in January. So
And you had a lot of success with your
yeah,
first gut club.
yeah, it was really good.
And maybe tell folks too, if they, I know I send patients to Dr. Scholl, how can, I know you have a website, do you want to
Yep.
just reiterate how to get in touch with you?
Yep, so my website is gastrodirectnc.com, and they can just enroll in the practice, and there's no charge to do that. Just, you know, when you submit your information, your health history and stuff, you appear in my medical software, and then we'll reach out and schedule you.
Will you take patients out of state? Because all my girls are going to ask.
I'm licensed in South Carolina. I will be soon in Virginia. I can't do medical treatment across state lines, although there is, do you know about reciprocal licensing that's in the Senate? So there are 39 states that participate in reciprocal medical licensing, and that means that if you're licensed in one of the participating states, you can just pay the fee to get licensed in another. Like if you're good enough for Arizona, you're good enough for Texas,
Right.
kind of thing. And that's coming up for vote in the House October 5th,
Yeah.
maybe.
I wouldn't be surprised if that passes, just because we're on a provider shortage
The
everywhere.
AMA is on board with
Yeah,
it.
the
So
states are just having to pull, especially emergency rooms, you know, from everywhere.
yeah. So it may be that but then it's also really expensive to get licensed in every state. But I can do the gut club, like that's
Right.
intended to be worldwide.
Okay.
So anybody can do that.
Okay, cool.
But you can, you're like me, you can see them if they see you on North Carolina
Yep.
soil. So
So first visit, and then you can do virtual?
they'd have to see her.
Okay.
We only can do virtual if they're North Carolina residents, or like if you're boarded in South Carolina and they're South Carolina residents.
Okay.
But it doesn't mean that you have to be in my office. If you have a sister who lives in South Carolina and you have your feet on South Carolina soil, you can call me the minute you hit the line, and we can start telemed.
Okay.
I mean, it's just licensing stuff.
Yeah, yeah.
Well, thank you for moderating, Kendra. This was fun. And
Thank you, Lisa.
everybody keep a lookout for November and December, our next YouTube sessions. And we'd love some feedback if there are things y'all want to hear about.